Podiatric Medical Examiners Advisory Board. It's 10 o'clock at the North Campus. Can we start with a roll call, please?
Good morning. Dr. Motley?
Here.
Dr. Lunsford?
Present.
Dr. Martin?
Here.
Dr. Campbell? Here. Dr. Peach? Dr. Brown?
Here.
We have a quorum.
Thank you. And we're still waiting on our 3 appointments from the governor's office for our public members, but we would like to welcome Dr. Corey Brown, who comes with us from Abilene, so we're glad to have him. He's welcome to suffer with the rest of us. But on that note, he has to entertain a little bit of Open Meetings Act training, which is going to start right now.
Colleen Tuan, Assistant General Counsel for the Podiatric Medical Examiners Advisory Board. I'd also like to introduce Alex Phipps. He's also an Assistant General Counsel for the Podiatric Medical Examiners Advisory Board. Now, the board will have both of us if you guys need anything, so you have 2 GCs for the program. So the rest of the advisory board members have seen this in April. Feel free to tune me out. Sorry, Dr. Brown. You have to pay attention. So we'll go through the Open Meetings Act, Administrative Procedures Act, and the Public Information Act today. So first with the Open Meetings Act, it's to ensure open and transparent government. So the act requires that meetings of governmental bodies, the advisory board, needs to be open to the public, be preceded by public notice about the time, place, and subject matter of the meeting. So the provisions of the act are mandatory and are to be liberally construed in favor of open government. So the first key concept we have is a quorum. So a quorum is the majority of the members of the advisory board as fixed by rule or statute. The majority, a quorum of the advisory board members must be present in order to take any official action, which is what we'll do today when we go through the rules. And then if a quorum isn't present, the advisory board can still meet, but they just can't take any official action. Another key concept is deliberation. It means a verbal or written exchange between a quorum of the advisory board members, between themselves or between the advisory board members and somebody, and another person, maybe somebody from the public, concerning any issue that's within the jurisdiction of the advisory board. A meeting occurs anytime there's a quorum of members engaging in a deliberation regarding public business or a policy over which the advisory board has supervision or control, or anytime the advisory board takes any sort of formal action. So notice is another key concept here. So notice is required. It's advance written notice of the date, time, place, and subject of each meeting held. We provide that to the public in the form of our agenda, which is before you and it's handed out. That agenda is actually filed with the Texas Secretary of State 7 days prior to the meeting, and it has to be posted online, both at TDLR and with the SOS. And the advisory board may not engage in discussions about subjects that are not included in that agenda. So what about social functions, conventions, and workshops? Can you still meet without violating quorum? Of course you can. So members are free to engage in conversations that are incidental to an event. However, the gathering will be considered subject to open meetings if a quorum of the members engage in any sort of discussion about board or committee business or try to attempt to take any sort of formal action. So I understand you guys all go to association meetings and conferences and stuff together. Just try to be cognizant when and if there's a possibility of a quorum of members and what is being discussed if it's board business. Some key points to remember: be aware of your situations occurring outside of a properly noticed meeting. Don't engage in substantive conversations relating to your advisory board business or policy when there is a quorum and you're outside of a properly noticed meeting. And be aware of the walking quorum. So what's the walking quorum? It occurs when fewer than a quorum of members engage in discussion about official board business, and then they communicate that discussion to now a quorum of members. So while they started in a smaller group and it's not a quorum, they've subsequently communicated it to a quorum of members. And that's outside of a publicly noticed meeting. So on a 5-member advisory board, if you have 2 members exchanging emails or participating in work groups about a rule or a proposed change, and it takes 1 member on that if they forward it to another advisory board member. Now you have a quorum on a 5-member board discussing something outside of a properly noticed meeting, so just be careful. So for your advisory boards, a quorum is 5. So that's why our work groups have 4 members, so just be careful. How do they occur? Conference calls, video conferences, hallway conversations. You'll see me hover in between if we take a break, just to make sure that a quorum of members aren't discussing board business, emails, text messages, and other technologies. And this the concept of a walking quorum and the newer technologies like the Twitters and the Facebooks and instant messaging raise new issues about meetings and compliance with the Open Meetings Act, so just be careful. Some best practices to avoid walking quorums. Members should not meet in small groups to discuss advisory board business and then communicate those discussions to other members. Email or text a quorum of the members, even if it's on an individual basis. Social media posts about board business where a quorum of members can participate in that conversation, or ask members, even on an individual basis, about feedback or comment outside of a publicly noticed meeting, because that's kind of called polling, and that's against the act as well. So guidelines for open sessions is what we have here. An advisory board is limited to discussing the specific items on the agenda. During public comment, the public commenter can bring up any issue that they want to speak about, and they're more than welcome to do that. But if it's outside of what's properly noticed, they can raise that as something that you can bring up at the next advisory board meeting, but you can ask clarifying questions, but you can't engage in that conversation with them at that time because it's not been properly noticed if it's not already on the agenda. So to avoid violating the act on the basis of insufficient notice, members should limit their discussion to specific agenda items contained in the posting filed with the SOS. Avoid allowing discussions regarding specific agenda items to wander into new issues, and Alex and I will be there to kind of help make sure that we keep to the agenda. Don't respond or discuss issues that are raised during public comment that aren't on the agenda, as only kind of ask for them to be on the next agenda so people are on notice that we're discussing them. And identify those specific future agenda items that you want to have and see and discuss in a public forum. So what are the penalties? There's civil remedies. So any interested person, including the media, can petition the courts to stop any action in violation of the Open Meetings Act. And the Open Meetings Act specifically states that an action taken in violation of itself is voidable. So criminal penalties for knowingly participating in a walking quorum or knowingly participating in a meeting that's closed to the public is subject to misdemeanor penalties, and that's a fine of $100 to $500 or confinement in jail from 1 to 6 or both. So best practices: avoid communication that involves a quorum of the advisory board members outside of an officially noticed meeting. And during the open meetings, confine your discussions to specifically posted agenda items. Here's some additional resources that also appear in your materials if you should need them, and you're always welcome to reach out to us if you have any questions or concerns. Next, we'll go on to the APA, unless you have questions, Dr. Brown? So the purpose of the APA is to establish minimum standards of uniform practice and procedures for state agencies and provide the public participation and the transparency during the rulemaking process. This is what we'll start today. So a rule is a statement made by a state agency that implements, interprets, or prescribes law or policy and describes the procedure or practice of the requirements of a state agency. It's a statement of general applicability and includes amendments or repeals to current rules or prior rules, and doesn't solely relate to the internal management or organization of a state agency. So what are the sources of it? You'll see the sources in your packet today for your rules are all legislative, I believe. But advisory board work groups can come up with rules that they want to see implemented, advisory board discussions that you may have here. Staff, HEMET, comes up with a lot of things. The 4-year rule review or a rule petition. What's a rule petition? So an interested person may submit a petition to a state agency requesting the adoption of a rule. The interested person is anyone who's a Texas resident, business entity located in Texas, governmental subdivision in Texas, or a public or private organization that's not a state agency but also located in Texas. So this is the process for Administrative Procedures Act and rulemaking. You have the idea, drafting of rules. So the idea is our legislative stuff. Draft rules are sent for advisory board for consideration. Those are your work groups that you've participated in. Those proposed rules. And then this is also where we'll discuss them today. And you guys will vote, hopefully, to propose them to the Texas Register. They'll sit out for 30 days for public comment. They'll come back, the comments will come back for review. We'll present those to you again. And if there are changes, they can go back out if they're substantive. If not, we'll recommend them for commission. Commission will review the rule, the filing, the comments, and then hopefully move them for adoption with the Texas Register. And they become effective 20 days after they're filed and through that process. So we're in the first blue box today. The other process to review rules is on a 4-year rule review process. So every program here at TDLR is on a 4-year schedule to see whether or not the rules are published and it says, hey, are these rules still necessary to implement the program? Should they be repealed? Should they continue going? Should they be changed? Those 4-year rule review cycles go out, so notice of intent to review. They sit for 30 days for comment. Those comments come back to us and go directly to the commission saying, yes, these rules are still necessary, but there's some substantive changes. If there are things that need to be considered, those go out to the advisory boards to consider as well. And then will be presented to the advisory boards for comments or changes if necessary, and then it will go back through the other rulemaking process. Here's additional resources for you for rulemaking. Questions or concerns? And the last little bit is the Public Information Act. So the Public Information Act is intended to allow each person information about the affairs of government and the official acts of public officials and employees. The Act makes all documents, records, and other information relating to official business open to the public, with some exceptions, and we'll go through that in a minute. And public information includes any electronic communication created, transmitted, received, or maintained on any device if it is in connection with official business. The Act should be construed liberally in favor of granting requests for information. So if a request is received, if you receive a request, just please forward it on to us as soon as possible because we have to respond timely. And if we ask you for information, if we need to respond to a public information request, please try and be timely as well. A prompt response on an open records request is about 10 days. And we can't ask people why they want the information, only if we don't understand exactly what they're looking for. Some outright exceptions to disclosure are that will already be redacted is date of birth, emails, certain educational documents, HIPAA information, and Texas Medical Records Privacy Act info. Additional information if you should need it. Questions or concerns?
No. Awesome. Thanks for doing that, Ms. Tran. That's you can get down in the weeds with that with some of those references if you're interested. But the important part that seems like they could happen a lot is like the walking quorum, and remember it's any device. You can watch that on the news at any time if you're curious what devices mean. Welcome, you're now official, so now we can deliberate and you can vote so we can carry on. Having done that, I assume everyone's had a chance to review the minutes from April 15th, so I'll take a motion.
Motion to approve.
Second.
First and second. Any discussion about those minutes or corrections? All in favor, aye.
Aye.
Any opposed? Moving forward. Agenda item E is public comment. We welcome any public comment, but I'll limit those to something reasonable like 3 minutes. If anyone has any public comment. That was agenda item E. Agenda item F are staff reports. So we'll start with licensing division.
Good morning, board members. My name is Laura Hernandez with the licensing department. I submitted the statistics for the podiatry program for the fiscal year 2018 and fiscal year 2019 for both the doctors of podiatric medicine and also the podiatric medical radiological technician. If we have any questions on these statistics for these 2 years.
The question would be, are we cleared up on the fingerprinting portion of that?
So I do have an update on our renewals for this year. We did move to a new licensing system to better get equipped to handle renewals at a faster pace, and there was several doctors that needed to submit fingerprints. As of this morning, we have about 30 that have renewed and not issued due to no fingerprints on file. We're going to do one more check for all those 30 to make sure they're not out there, and then contact them by email to let them know that the license has not issued yet, and try to work with them to get those fingerprints done. We have about 75 podiatrists that are eligible to renew but have not renewed at all. Not a pain or anything, but we will check on the 30 that have been submitted.
Okay. So for now, those 30 are still operating under a temporary type license? An
Correct.
extended type?
We extended the
Okay.
expiration date to December 1.
And we're proactive on telling those physicians, please don't forget to send me the stuff on your fingerprints?
Right, we're doing a check today on our
Okay.
spreadsheet for those 30, and then contacting the others by email or by phone.
That's good. We all need some hand-holding from time to time, so thanks for doing that.
We got it.
All right, great. Any questions from the group? No. All right. Thank you, Laura.
Thank you.
Customer service?
Good morning, advisory board members. My name is Tuan. I'm one of the managers for the customer service department. Before we go into the statistics, I do have some updates for y'all since the last time we've seen each other. So customer service have now moved over to our North Campus location, so we're now located in this building on the second floor. We have also updated our contact center software since June 10th. So that's going to be allowed to get more detailed reports. I'm hoping next time we meet, I might have something extra for y'all. Also, we have updated our email process on the website. So before, people would have to send it to cs.podiatry. That is still available to customers, but if customers are on our direct website, they can go to our web form link and actually give us detailed information about their contact details and still upload documents and send emails, and that will go directly to our email shared mailbox securely. And that's one of the main things we're pushing for, is that it's a secure email, and every time people choose their industry from the drop-down menu, it goes straight to us without people worrying that it hasn't been received or not. Okay. And then for our statistics, statistics for us has been relatively normal. You haven't seen October stats, but it's definitely going to be, that's where our peak was for this year. A lot of people are still calling about verification of licenses and also questions about the laws and rules, which we forward to our RPM team. Other than that, I'll be happy to answer any questions you have for me.
Any questions? What's your average, I don't know if y'all track this data as well, average time to return emails or get a response out?
Emails, typically after a holiday, it's a little bit longer than a couple of days, but right now it's 24 hours. People should get a response.
Fantastic. That's great.
Mhm.
Thank you very much.
You're welcome.
Enforcement Division?
Good morning, board members. My name is Jessica Hurtado. I'm a prosecutor with the Enforcement Division. From the enforcement report, you can see that there were 3 agreed orders that were entered into since your last meeting. The first one, in which the respondent accepted a penalty of $1,500. So that was for ordering genetic testing on a patient whose medical condition didn't warrant that testing, and that agreed order has been paid in full. The second case involved a respondent who accepted a penalty of $1,875 for failing to practice podiatry in a manner consistent with public health and safety, and that one has also been paid in full. The final agreed order involved 3 counts of failing to keep accurate records for patients, and that was for a penalty of $3,000. And they have, that respondent is on a payment plan and has made the first payment. Any questions about the case highlights?
I just have
Sure.
a quick one. Are these values assigned through like a penalty matrix?
Yes, Dr. Motley, the department has adopted the penalty matrix as part of the last rule package, and so that's what guides the prosecutors, myself and Karen, when we're sending a notice. We look at what the violation is, and in the penalty matrix, what the possible penalty range is. Okay. Any other questions?
So on your statistics, there have been 85 cases opened and 104 resolved, is that correct?
Yes, so getting to the statistics, that you can see there the number of cases opened and the Last fiscal year was 85, and the number resolved was 104. That's clearing up the backlog from the prior year. So we're getting, that's good. We're closing more cases than we're opening. So
What's our backlog? Do we have it here?
right now, we have 67 cases that are open. And you can see that there were 5 final orders in the last fiscal year with the amount of the penalties assessed there, which have all been collected. And you also have statistics on the prior fiscal year. You can see that prior there were 148 cases opened and only 65 resolved, so those were carried forward and we're getting to those now. Any other questions that I can help you with?
That's fantastic. You close more than you open. That's
Yes.
got to be some kind of record. That's really great. I don't have any questions. Any others?
Okay, thank you.
Okay, thank you very much. Education and examination.
Good morning, Chair, Advisory Board members. My name is Rebecca Armas. I'm Education and Examination Liaison. Welcome, Dr. Brown. I'd like to just go over a few things for you. Just as an FYI, we're looking to have a spring exam review session for the exam. We may be running a posting for selection of exam subject matter experts to assist us with the review of the examination, so just be on the lookout for that. We don't have an exact date. We're just hoping that early spring we'll meet to go over some maintenance of the examination. As you see for our fiscal year 2020 thus far, not very much as far as, I guess you could, attempts at the examination. Those usually happen in the spring, as you can see from the previous fiscal years. And I'll be happy to answer any other questions if you have any.
Any questions from the committee? Okay, thank you very much.
Thank you.
Number 5, Regulatory Program Management Division.
Good morning. I'm Katie Bryce with the Medical and Health Professions section of Regulatory Program Management, and I'll be giving the report today. You have our staff report, but I want to go over a few highlights. Amanda Vasquez has joined our group as an executive assistant. Amanda, do you want to stand up or wave over there? We're very happy to have her working with our group. Our PM staff has been very busy participating on bill implementation teams. We've helped with some rule drafting, and we'll be going over that later. Program staff continue to work with the pharmacy board to facilitate registration and education about the PNP program to podiatrists. Several TDLR staff members attended the Texas Podiatric Medical Association Southwest Foot and Ankle Conference in Frisco in September. We had a booth and gave a presentation, and always enjoy having the opportunity to interact with our licensees. The next issue of our health monitor will go out in December, so please look for that. We'll send it out to people who have subscribed for email updates, and it's also available from our website. Do you have any questions?
Any questions from the committee? I'll
Nope.
tell you, your outreach is really important. I think there was obviously a lot of worry when this happened, but to meet individuals and then do labs with individuals and actually have like normal human interaction, not TDLR to podiatrist interaction, it's a big difference, and I think that's a huge part of what y'all do.
Yeah, thank you. We enjoy it.
Good. Anything else? Fantastic. Executive Office, number 6.
Dr. Motley, board members, my name is Mike Arismenis. I'm the Deputy Executive Director for the agency. I want to welcome you. Of course, Dr. Brown, first meeting, welcome you here. I appreciate the service that you all provide for the state of Texas and for your industry. I know that you will serve as the voice for that industry, and we appreciate all the work that you provide, and you're willing to be able to come in and do that. So we do want to let you know that TDLR appreciates your time. A couple of quick things I want to mention to you. Of course, coming out of legislative session, we had a very busy session as usual. I think the last time we met, we were in the middle of session. So out of that, we were able to obtain a few things that we've been working on since. I believe HB 2847, which is what you'll see a lot of in the next item, contained a lot of cleanup for the agency. And so it was a big bill that we had passed, and we look forward to continue to implement the bill in itself. But we also received some additional things coming out of session. We are now regulating and licensing motor fuels. All the fuel pumps that you see in the state of Texas now will belong to the Texas Department of Licensing and Regulation. That puts us at about 1.2 million licenses for our agency. So we're in the process of going through that transition with the Texas Department of Agriculture. It's been a very good transition, and we continue to work with them. But we'll also now begin the work of also bringing over motorcycle ATV education, safety, motorcycle safety. We'll begin that process. They will begin here September 1 of next year. But there's a lot of work that has to be done ahead of time, which is what we're now in the process of doing and working through that. So we're looking at having that. Some of the other things that came out of that is we received funding for a new licensing system in our IT department, so we look forward to being able to kind of create that. Also, we have started and we're funded for a human trafficking division and section in our agency. So we have now created an anti-trafficking unit in the department, and we are in the process of beginning to looking at applications for those positions. We have brought on one individual as an intern, but now is a full-fledged part of our anti-trafficking unit, Brian Cottle. But along with that, we will have some additional folks that will come on board. With those programs that I mentioned right now, we will be adding approximately 100 FTEs to our agency with motor fuels, motorcycle ATV, IT, and the human trafficking component. We'll bring on, I believe it's about 93 FTEs. So it's some much needed help along with the programs that we have, but some much needed help that we also need in other parts of our agency. One of the things I do want to mention is that our Deputy Executive Director, Carla James, I say current, she's actually a former Deputy Executive Director. She's retired, and so her last day was November 1. So she's moved on, but since then, we have now supplemented those her duties. It took 2 people to fill her position. So we hired David Gonzalez, who's back here in the back. He'll be a new Deputy Executive Director along with Christina Kaiser, and they will begin their duties beginning December 1. And so we look forward to having them on board and being able to have you meet them much more personal level and as we continue to grow. We're also in the middle of Sunset. We're in the Sunset review process, which has been a very enlightening process for us also as we begin to look more deeply into our programs here at TDLR. I believe we had about 17 meetings in October with Sunset, and they continue to be a part of who we are. We will be in the Sunset process. I think they're going to be with us until about March, I believe, of next year, May of next year. I was just corrected as usual. So we'll continue to have them around, and you may see them at various functions, various meetings. It's been a great process for us. You'll also have the opportunity to be able to make comments concerning the department. They will reach out to you through our listserv. They'll send you a survey, and we encourage everyone in your industry, as our other industries, to provide feedback on how we can improve TDLR and make it a much better agency. So we look forward to having you do that. They will open up for some public hearings also, the opportunity to be able to come and visit with the Sunset staff and Sunset Commission and be able to speak directly to them in a public comment, a public setting. So be kind of on the lookout for that. We do have it on our front page. If you go to the front page of our website, you will see the Sunset processes there and also the ability for you to be able to make comments. Speaking of our website, I do want to kind of give you a little bit of information about the Podiatry website. For the last 6 months, your Podiatry website has had 19,771 views, which is about 108 per day. Of that, 79% accessed through a desktop, while 17% accessed through a smartphone and 4% on a tablet. We have a pretty crackpot team of web masters, so they're able to provide all this information for us. I don't know how they do it, but they do. The top 5 reasons to visit the website: number 1 is primary source verification. Number 2 is frequently asked questions. Number 3 are forms. The number 4 reason to go out and visit the website are administrative rules. And then the number 5 reason, which I think should be number 1, number 5 reason is they want to see who the advisory board members are. So they go out and take a look at your picture and see who you are, so they'll know exactly who is a part in heading up this industry. So the last thing I do want to mention is, and I've saved it for last, just so you know, Macon has now moved into the executive office as a management analyst, and so he's moved into a much more diverse role with the agency. I think that I don't have to tell you about who he is and what he does. Lee Iacocca said, always, hire people smarter than you and get out of their way. So we're going to get out of the way of him and let him do what he needs to. So we look forward to having him with us and working at the executive level. So, and that's all I have. I'll be happy to answer any questions.
Very good. Any questions from the committee? Well, congratulations, Mr. Macon. We've obviously worked with him for a long time. I think people probably look for the advisory board members on the website so they know who to call and complain to, like a customer service agent, I think. But as you move UTV and ATV over, we have a great conference through TPMA every September in Frisco, so you could lump those together. That way, if anybody gets hurt in the education process on a UTV, we're there to help.
We just put it there.
You can
Yeah,
lump
we
them
can
in.
do that. Dr. Miley, I did want to mention, and I'm glad that I was just reminded also, I tell you that you surround yourself with people and they tell you what to do. Podiatry is not currently under sunset review. They will be in the next go-around. The way that the bill was passed is that all programs that we received prior to 2016 are currently under sunset. And the next go-around, which will begin 2021, all the programs received by TDLR after 2016 will be under sunset review. So sunset review won't happen for podiatry until then. But again, feel free to reach out and make any comments that you would like to at the time. They'll take everything. Thank you.
Thank you very much, Mike. Next agenda item is G, discussion and possible recommendations on proposed amendments, and that's going to be Ms. Tran and Mr. Bibb. So I think they're going to divide and conquer this one.
Good morning, advisory board members. Colleen Tran, Assistant General Counsel. We are going to go through the draft proposed rules today. I'll go section by section. They should be in your materials. Feel free to stop me if you want to discuss anything or want to make any changes and halfway through. Mr. Phipps will take over. So on page 1, we have our first change to section 130.42. We add the requirement for human trafficking prevention training. It was required by House Bill 2059. That training will be developed and approved by the Health and Human Services Commission. We've been in contact with them and working with them. So we will, that requirement's doesn't begin until September 1, 2020, but we will keep everybody apprised as it goes on. But it is a requirement for renewal per law. Next change is to section 130.44. You've seen we've added human trafficking prevention to what you can take as a part of your CE, because it also is already required by 2059. And then per 2174, there's 2 hours required for CME for before the first anniversary on opioids for somebody who's newly licensed, and then there's additional CE for those who practice annually attend at least 1 hour of CME on opioid treatment options, multimodal approaches to pain. In the back of that section, we've also added some language to address the 2-year license term that we just implemented in September to address CME changes as well. We did the change for the license term. We needed to catch up the CME requirements. And so you'll see that change in new subsection J, just to clarify what is going to be required going forward as we go into a 2-year license term. And then O is just our transition language to make sure that we do it correctly for all licensees. Section 130.45, we've removed subsection F because it's redundant to section 130.44F, which is new H. That's the requirement, is already in law, in the rules. Section 130.53, podiatric medical or radiological technicians. You'll see a lot of the changes here are from 2847. Specifically, if you look at subsection C right now, there's an extra comma I need to remove from your proposed rules here. So when we do vote, or if we vote on them, I'll just need to make that technical change. If not, these implement 2847 requirements and Chapter 601 Occupation Code requirements for rad techs. You'll also see in L5, we removed commission of an act of moral turpitude. That is a legislative change that has been made. It's similar to a change that's made in 202.253A1 in the law. It also has removed that. That's something that Sunset has been moving to remove that term, moral turpitude. So we're going to go ahead and clean up here as they remove it out of the law. And I skipped one, but just to let you know, the 2059, because rad techs have direct patient care, they're also required to do the human trafficking training that's provided. And HHSC will have a free version as well.
Okay, board members, I will take over. Alex Phipps, Assistant General Counsel. We are at section 130.56, and this is the general authority to delegate. So this change is coming out of HB 2847 as well. There's a new section of the Occupations Code, that's section 202.354. We've changed the existing rule here to mirror the language that's in that new section of the Occupations Code. So you'll see we've inserted Podiatric Medical Assistant and Podiatric Medical Act there in the first subsection A. You'll also see that there are corresponding changes lower in that section. The phrase, in the opinion of delegating podiatrist, that's in subsection A1. You'll also see, again, podiatric medical assistant and podiatric is inserted later on. Additionally, that subsection 1C has snapped up into subsection 1B, so that's a clarification change as well. Of course, again, the changes here do mirror the language of the statute exactly. So if you have any questions about those changes, please let me know. Otherwise, we'll move on. Okay. The next section we have for you is section 130.58. That's the standards for prescribing controlled substances and dangerous drugs. So the changes to this section come from two different bills. House Bill 2174 is the first change. You'll see that a podiatrist can now designate an agent to communicate a prescription to a pharmacist. So this is coming directly out of the changes to Chapter 481 of the Health and Safety Code. That's the Controlled Substances Act. This allows a podiatrist to designate someone who can communicate on their behalf to a pharmacist. The next change that we have is from House Bill 3284. This change effectively makes it against the rule to access the PMP for reasons not directly related to a patient under the podiatrist's care. So the PMP is the prescription monitoring program. I'm sure you're all familiar with that. So those changes are both coming out of the new parts of Chapter 481 of the Health and Safety Code. If you have any questions at all about that, I'd be happy to answer those. Okay, I'll move on to the new section 130.59. So this is a new rule section. This is opioid prescription limits and required electronic prescribing. So these sections are both coming from House Bill 2174. Again, changes to the Controlled Substances Act here in Texas. The first section of this is a definition of acute pain. And the definition is there because there's now a limit on prescriptions for acute pain for opioids in the state of Texas. That limit is 10 days. So here we have the definition coming from Chapter 481 of the Health and Safety Code, and Section B being the prohibition of prescribing an excess of 10-day supply for an opioid for acute pain. The next section would be the new requirement for all controlled substances to be prescribed electronically. Now, there is an extremely long list of exceptions to this, and this requirement does not go into effect until January 1st, 2021. But we do have all of the exceptions incorporated here into the rule. And again, all of this comes from House Bill 2174 and the changes to the Texas Controlled Substances Act. So I'm happy to answer any questions you may have about that.
Just for a question,
Sure.
number one, thanks for doing all that.
Sure.
And excellent explanation. But under 130.59B, it says provide for a refill of an opioid. I think just to be clear, because we will get asked this question once we're out of the meeting. If someone actually reads that, they need to understand that there can be a prescription for an opioid at the time of injury, and then another prescription for the same opioid or different at the time of surgery. So those are two different events that need, because I know we're going to get asked that, so I'm going to ask you now to make sure that I'm understanding that correctly.
Good. Yeah.
Okay. So per event, a prescription for an opioid, but not refills after surgery over 10 days.
Yes.
10 days. If anything else, just remember 10 days.
Yes, absolutely. Yeah. And I'm sure there will be a lot of education in the community about this, as this is not just applicable to podiatrists, it's across the board. So.
Okay.
Okay. Anything else I can help clarify on that section? Okay. All right, we'll move on to the next section. That's 130.60. This is the fees section. So the two changes here in the fees section are coming from cleanup, of course, from HB 2847. The first change that you'll see is that the department is providing for a fee for active duty military members. That fee is $0. The next change you'll see is that we are providing for a new fee for podiatric medical radiological technicians. That's $25. Those are the only two changes to that section, but happy to answer any questions you may have. Okay, we'll move on to the next section. That's section 130.72. This is the administrative penalties and sanctions section. So we have two different House bills that are affecting this section. The first would be House Bill 1899. The second is House Bill 3284. But the way they're incorporated into this section is actually the reverse of that. So we'll walk through the changes first. Subsection B makes it grounds for discipline for someone to access the PMP not authorized to receive that information through the law. So, of course, if you access a PMP and you are looking at someone you are not permitted to look at, then you may be subject to discipline under this section. The next section, likewise in subsection C, prohibits someone accessing the PMP. Again, you're committing an offense if you access that. Subsection D, likewise another section about PMP. So those three sections effectively make it an offense under the board's or the department's rules to access the PMP, disseminate the information accessed from that PMP, or use a material misrepresentation or just fail to disclose a material fact when accessing the PMP. All of that is incorporated under 3284, House Bill 3284. So that will allow the department to take disciplinary action if necessary if someone is violating those sections while using the PMP. The next two sections, subsections E and subsection F, incorporate House Bill 1899. So these create a new chapter of the Occupations Code. That's Chapter 108. Subchapter B of Chapter 108 of the Occupations Code creates a new disciplinary structure allowing for the automatic denial or revocation of certain health professions licenses or offenses. Those offenses are effectively the requirement to register as a sex offender in the state of Texas, an offense that is a felony involving the use of force, or certain assaultive offenses against a patient under the care of the healthcare professional. So those are very specific situations. We did not obviously put that completely in this rule, but that is all laid out in Chapter 108 of the Occupations Code. So happy to answer any questions you may have about this section. Do any clarification?
Okay.
All right.
Thank you very much. So I'm going to make this as one lump sum, but the motion to publish this in the Texas Register includes modifications to Chapter 130, with the exception of 130.53, letter C, where we will remove one comma. Motion. Second? Okay. All in favor? Aye. Any opposed? Okay. Thank you. That was agenda item GH is work group members. So we currently have work groups, enforcement, licensing, education, examination, standard of care. So what I propose, but certainly open to any suggestions anyone has, is that Dr. Brown can replace Dr. those spots previously occupied by Dr. Carpenter, so that will include licensing and education and examination work groups. Are you okay voluntolding for that one?
Yes.
Excellent. And then that will still leave one open spot, so these work groups will have 4. I also propose that we leave that open for public members so that we can have their input once they're appointed. Any suggestions? Everybody agree? Okay. Along those lines, education and examination, Dr. Martin, do you want to talk about kind of the plan for medical assistants or the rad techs that you've been working on, and that we'll move that to your work group?
Yeah.
Dr. Motley?
Yes.
Colleen Tran, Assistant General Counsel. Are you under agenda item J?
No, we're under I,
I. Okay.
just to make sure that this goes to the right work group. And then it will be placed under J.
Moved in J. Okay.
Yeah. Thank you for clarifying.
Yeah, so I came up with some recommendations for CME, for the rad techs, and I basically went through the CME requirements from the NCTs and looked at what was previous and existed previously, and I modified that somewhat, and it's in this packet. And Hammond has kind of put this together as well, and I think this would be good to move to a work group to hammer out any more details about it.
I agree.
So I would move that we move it to
Okay. So we'll put that on an agenda item and through the education examination work group. And by the way, this is not something that just started. This is something that is like constantly evolving and dynamic, and Dr. Martin's been working on this with Hammond for a long time. A long time, yeah. And it takes a long time to get everybody on board and where it works for everyone, now that we're TDLR types. Okay. So we'll put that, that is one recommendation for an agenda item for the next board meeting. Any other recommendations for other agenda items? And I want to make sure I kind of cut off I. Are there any other reports from any of the other work groups, whether it be enforcement, licensing, or standard of care? Okay. Then we'll skip that.
Just so that you know, we met, Standard of Care Work Group actually met October 15th, and a lot of the work that we did was just to clarify, review, and edit the draft rules, the language that was covered during the rule discussion that we had this morning. So I don't want to be redundant about that, but we did discuss the delegation to the podiatric medical assistant. The new rule language comes directly from the changes to the Occupation Code 202.354 from the House Bill 2847 as previously discussed. Again, we also discussed the standards for prescribing controlled substances and dangerous drugs. And again, that information was elucidated previously by our attorneys this morning, as well as the opioid prescription limits and required electronic prescribing. I think that there may be some interesting questions that arise regarding the 10-day period, in that there will be some confusion moving forward from our licensees, in that we will have to clarify that per incident, if one is doing surgery and there's a 10-day limit, one may not actually place a refill on the original prescription, but once that 10-day period has been exhausted, if the patient comes back in, they may be allotted a refill by the practitioner after that 10-day period has been exhausted, if that's my understanding. And that was elucidated. Okay. We also had some discussion regarding frequently asked questions relating to discussions regarding the hiring of an APRNA as physician extender and why that is not permitted. And we also talked about telehealth and telemedicine, and described the definitions therein and the application of current definitions to the practice of podiatric medicine. So we had a busy phone call, so thank you.
Thank you all for doing that. And the reason we get clarification is because even though we have this resource, they pound these cell phones all the time with these questions. So we want to make sure we're all on the same page. So thank you for doing that for the group. As far as agenda item K, the guesstimate or estimate is February of 2020, but assume we can confirm a room and date through email as we have done previously. Okay? That is the end of the agenda for this meeting. Did I skip anything, miss anything? Okay. We're adjourned at 10:51.